Hansen's disease by Vanessa Chavez. So here are some key facts. Hansen's disease is also known as leprosy. It is caused by an infectious bacteria that is very slow growing called Mycobacterium leprae. The bacteria is extremely slow growing. Its incubation period is on average 5 years. And it can take up 1 to 20 years for signs and symptoms to present. It can affect nerves, skin, eyes, and lining of the nasal mucosa. It was once feared as a highly contagious and devastating disease. We now know that it doesn't spread easily and treatment is very effective. With early diagnosis and treatment, the disease can be cured. Clinical presentation. So this is what hands of someone with untreated leprosy can look like. Skin signs and symptoms. You can have discolored patches of skin, growths or nodules on the skin, thick, stiff or dry skin, painless ulcers on the soles of the feet, painless swelling and lumps on the face and earlobes, loss of eyebrows or eyelashes. So the top picture are just illustrations of what someone with untreated leprosy can look like. And the bottom is the skin patches, the discolored skin patches. Nerve signs and symptoms. So one can have numbness to the affected areas on the skin, muscle weakness and paralysis, especially in the hands and feet, enlarged nerves, as you could see in that bottom picture, and visual disturbances that can lead to blindness. Mode of transmission. So it's actually unknown or fully understood how Hansen's disease is transmitted. They believe that it is droplet transmitted, but again, they are not sure. So they are sure that prolonged close contact with someone with untreated leprosy over many, many months is needed to catch the disease. So you cannot get it from shaking hands, hugging, or sitting next to somebody with Hansen's disease. It's also not passed from mother to baby during pregnancy, nor is it spread through sexual contact. In the US, some armadillos are naturally infected with the bacteria that cause Hansen's disease, and it's possible that they can spread it to people. Prevention. Prevalence and at risk. So the prevalence in the US of Hansen's disease is very rare. Around the world, as many as 2 million people are permanently disabled as a result of Hansen's disease. Overall, the risk of getting Hansen's for many adults around the world is very low. More than 95% of all people have a natural immunity to the disease. Who is at risk? Those with increased risk are those who live with someone or are close to someone with untreated Hansen's disease. As soon as the patient starts treatment, they're no longer able to spread the disease. You also have an increased risk if you live in a country where there's a high prevalence of Hansen's disease. This is a world map of the many places that have active cases of Hansen's disease. So in the US, about 150 people are infected. In the world, about 250,000 people are infected. India India accounts for about 60% of the new Hansen's disease diagnoses. I've also listed the countries that have reported more than 1,000 new cases of Hansen's disease to the WHO between 2011 and 2015. And those lists come from Africa, Asia, and the Americas. In 2017, 211,000 people were diagnosed with Hansen's disease globally, and that came from 159 different countries. Prevention. So leprosy is not contagious, and the risk of spread is very low. Clinical trials have shown that the Bacillus Calmette-Guerin vaccine has been effective in preventing Hansen's disease. It is not used at the time, but hopefully in the future they will use it to eradicate Hansen's. It's also recommended to avoid contact with armadillos. The most effective way to prevent Hansen's disease is to treat the patient to ensure that they are no longer contagious. It is also recommended to avoid contact with bodily fluids and rashes of people who have Hansen's disease. And for those living with someone with Hansen's disease, it's very important to receive annual examinations for 5 years minimum to ensure that they are not also infected. Again, we said that the incubation period is on average 5 years, so they can get tested for that. How do lack of resources affect prevention? Although the incidence of Hansen's disease has declined, there are still many countries with over 1,000 new cases a year. If we can utilize the BCG vaccine, perhaps we can move towards this eradication of Hansen's disease. Of course, more research needs to be done in order for that to happen. Also, lack of hygienic resources and community education about Hansen's disease is needed. Many do not believe or know that Hansen's disease is a curable disease and continue to have historical and biblical beliefs of the disease and consider it a taboo. Diagnostics. Hansen's disease is diagnosed based on clinical presentation. The diagnosis is confirmed by skin and nerve biopsy and acid-fast staining. In rural areas, diagnosis is often established from the patient's clinical signs and symptoms. A careful skin and neurological exam are performed by healthcare professionals. Historically and biblically, Hansen's disease has been considered a social taboo. This leads many with the disease to avoid seeking care until the late stages of the disease, when deformities have already taken place. Hansen's disease is a treatable condition, and not seeking care due to social taboo is a behavior that needs to be changed. The treatment for Hansen's disease is a multi-drug therapy. It's 100% curable with these 3 drugs: dapsone, rifampicin, and clofazimine. HRSA and the WHO. HRSA is the Health Resources and Service Administration. They established the National Hansen's Disease Program here in the United States to they have this program as the epicenter of Hansen's disease care, research, and information in the U.S. They care for patients at its own facility in Baton Rouge called Ochsner Medical Center. They oversee a network of ambulatory care clinics throughout the U.S. and Puerto Rico. They conduct biomedical research, and they reach out to medical professionals with a comprehensive Hansen's disease training program. The WHO, World Health Organization. In 2016, the WHO launched its Global Leprosy Strategy from 2016 to 2020, accelerating towards a leprosy-free world to reinvigorate efforts for leprosy control. The strategy is built around 3 major pillars. They want to, 1, strengthen government and ownership. They are doing this by ensuring political commitment and adequate resources for leprosy programs. They are contributing to universal health coverage for a special focus on children, women, and the underserved. They are promoting partnerships with the state and non-state actors and promoting intersectoral collaboration and partnership with the international and national levels. They are facilitating and conducting basic and operational research in all aspects of leprosy and minimize the evidence base to inform policies, strategies, and activities. Pillar 2, stop leprosy and its complications. They are doing this by strengthening patient and community awareness of leprosy. They are promoting early case detection through active case findings in areas of high endemicity and contact management. So they're doing a lot of campaigns to promote leprosy and educate the community. They are also promoting interventions for the prevention of infection and disease. Pillar 3, stop discrimination and promote inclusion. They are doing this by promoting societal inclusion by addressing all forms of discrimination and stigma. They are empowering persons affected by leprosy and strengthening their capacity to participate actively in leprosy services. And they are also working towards abolishing discriminatory laws to promote policies facilitating inclusions of persons with leprosy. So I'm kind of going to just repeat that these are their goals globally and locally to reduce the burden of Hansen's disease. They do aim to have 0 disabilities among new pediatric patients. They're doing this, they want to reduce deformities amongst all patients, but they are mostly focusing on pediatric patients as they can be diagnosed earlier and lead a relatively normal life with decreased disabilities. Number 2, again, they are trying to reduce disability related to Hansen's disease at a rate of less than 1 case per million people. And 3, they aim to repeal all laws that discriminate against patients with Hansen's disease. Hansen's disease is very debilitating, and awareness is the key to ensure that these patients get the care that they want. Leprosy or Hansen's disease is a taboo disease, and that frame of thought needs to be changed in order to help cure others. The WHO, it actually is doing a lot to reduce the disease. They give away the medications, the 3 medications listed earlier, for free and have been funded to do so until 2020. Every month they have different setups in these different nations where monthly they give away free medication to patients that come seek it. Over the last 20 years, 16 million people have been treated and cured of Hansen's disease. That number can be greatly increased if this stigma against Hansen's disease is reduced. Thank you.